This video demonstrates both provider and nurse roles in ePrescribing a patient's medication. In this scenario, the nurse uses a new feature in the Outpatient Medication review to pull in the patient's medication history. While doing this, she reconciles different dosages of a single medication, and the provider electronically prescribes a medication. This is the third in a series of 7 videos.
The nurse begins by opening the Outpatient Medication review to collect home medications. She pulls in the patient's historical medication history by clicking the Meds from Other Sources button. A disclaimer will automatically appear and then close. She sees that amoxicillin 500 milligrams is in the patient's medication history. She confirms that this medication is still being taken and copies it into the OMR by selecting the tick box and pressing Copy to Med History. She then closes the window. The nurse then confirms that the amoxicillin 125 milligrams, which was already present in the patient's OMR, is no longer being taken and DCs it. The nurse then adds a preferred pharmacy by clicking on the link in the upper right-hand corner. She searches for Happy-Go-Lucky Pharmacy. Selects the pharmacy, presses Add to Preferred, and closes. The OMR is then saved as complete. The provider then takes over. The provider opens Prescription Writer and enters a prescription for Vistaril 25 milligrams PO once per day. The provider then presses Review and Submit. To submit the prescription electronically, the provider chooses a submit method of eSubmit. The provider then chooses her location and presses OK.